Good morning. Today I'd like to share with you a preliminary report on COVID-19 cases in our public schools. The Department of Public Health asks each county school district to report COVID cases. Although not every district has complied, we have collected enough data from the first week of the school year to report to the public. So far, we've identified 323 student cases and 51 staff cases in public schools. These cases led to quarantine for 1,214 individuals. The number I'm sharing today comes from 16 of St. Louis County's 23 school districts. And we know these numbers are artificially low, given that the data comes from only 1 week of classes. Not all school districts have reported their numbers, and many children who are being exposed to COVID are not being tested. Moreover, in the 2 weeks leading up to September 1st, the average rate of new cases among 10 to 14-year-olds increased by 44%. The current positivity rate among this group is 16.2%, much higher than the community average of about 10%. These numbers reveal that the level of transmission among our children is much too high. It's crucial that parents and educators take steps now to stop the transmission of COVID in schools. And here's why. While it's true that most children contract COVID-19 and won't get seriously ill, some do. And even if they don't get sick, students with COVID often spread the virus to others in the classroom and in their households. And that can cause another spike in our community at large, leading to more hospitalizations and more deaths. And we can't afford to let that happen. It's also important to understand that the Delta variant is different than previous strains of the virus. It's more easily transmissible, especially to children. And so here's what public health experts are advising for parents. Number one, get vaccinated, and get your children aged 12 and older vaccinated too. Vaccinations are safe, effective, and free, and they're available at most pharmacies and through the Department of Public Health at multiple locations across the county. To find a convenient time and place to get vaccinated, visit revivestl.com. Number two, have your children wear masks at school, even if your school doesn't require them. Masks are proven to reduce COVID transmission. They are a key tool in our arsenal to fight against the virus. Number three, if your child was exposed to someone with COVID, have them tested 3 to 5 days after their exposure. Testing is another crucial tool to reduce transmission. Again, to find a convenient site for a free test, visit revivestl.com. Number four, if your child experiences any symptoms associated with COVID, keep them home and have them tested, even if they've been vaccinated. Do not assume that symptoms like fever, cough, runny nose, or sore throat or headache are the result of allergies or cold. Number five, if your child is exposed or tests positive, follow the rules for quarantine and isolation. Your school district will instruct you on those requirements. Those who test positive must isolate for at least 10 days after the first symptom, or if they have no symptoms from the date of the test. For more information on quarantine or isolation, visit stlcorona.com. I want to finish by thanking our school districts for their hard work in keeping their students and staff safe. Most of our county school districts require masking for students and teachers. And we deeply appreciate that because we know that masking works to reduce transmission. Again, we urge every student and every staff member to mask up in schools regardless of the rules. We work very closely with our schools to monitor and protect against COVID, and that work will continue. Later today, the Health Department intends to release a report on school and youth COVID transmission so far, and the department will refresh its report every 2 weeks to provide up-to-date information to the public. Remember, we all have the same goal, to keep our kids in school, and that's where they learn best. To keep them in the classroom, let's all work together to reduce COVID transmission. And I'd be happy to take any questions.
Dr. Page, we have a two-part question from the Post-Dispatch. Have there been any reports of people not cooperating with school quarantine procedures or school nurses facing backlash?
So the question from the Post is about folks not cooperating with schools or school nurses with their instructions on isolation, quarantine, or testing. And we do have some reports. We'll detail that in our community report that'll be released later on today, and we'll have some examples. But I think it's important to recognize that our schools have a very difficult job, our teachers and school staff, and they need our support. We need to be following their direction on isolation and quarantine and testing, and that is really what gives our kids the best chance at in-classroom learning this fall. We really need to support our teachers and our staff and follow their direction on isolation and quarantine and testing.
That's all the questions we have.
Okay, thank you.